So my name is Noelia and I'm one of the nurses working for the corporate education team. And I'm here today to talk to you about the PPE for confirmed and suspected COVID-19 patients. On this training and on this presentation, we are going to find a refresher on hand hygiene and hand wash, as well about the use of gloves, and we are going to focus on the removal or doffing of the gloves using the pinch and pull technique. And then we are going to see the different level of PPE that we are going to be using on the OUH. We have level 1 and level 2, and we are going to see when we have to use it and where we have to use them. As I said, this is just a little bit of a refresher about the hand hygiene. You can see the 5 moments for hand hygiene at the point of care, and these 5 moments are going to be before we have any contact with the patient, after we have direct contact with the patient, before we are going to do a clean or antiseptic technique, after we have been exposed to any body fluid, and as well after we have been in contact with any of the patient's surrounding. It is going to be very important for you to remember that the gloves are not going to replace the hand hygiene, so make sure that you always wash your hands before and after you are using the gloves, and very important before and after you have a direct contact with the patient. I'm going to show you now a very quick video about hand hygiene, where you can see the different steps that we are going to follow in order to have an effective hand wash. In this case, it's going to be a hand wrap, and you will be able to see the different steps. Okay, so as you could see, that's the steps that we are going to follow for hand wrap, and we will follow the same steps if we are doing a hand wash with water and soap. It is very important for you to be aware that if we are having the hand wrap, like the one that we have seen on the video, that will take between 20 to 30 seconds to the liquid to evaporate, and that will be the time that we have to make sure that we clean all the areas of the hands, okay? If we are doing a hand wash with water and soap, that will take between 40 to 60 seconds. And it's very important to remember that we always will put first the water, and afterwards we'll use the soap. I have been looking about the hand wash, and I have seen that there is very often some areas of the hands that are omit on the hand wash. The most often are the thumbs. We tend to forget them quite often, and between fingers as well. And we also forget very often the tips of the finger, that will be the nails. So make sure, please, that when you are doing the hand wash, you try to don't forget that areas that are quite important. We are going to show you now a video about how to doff the gloves, and you are going to see the technique that we suggest you to do, and it's going to be the pinch and pull technique. That seems to be a very easy technique, but we always recommend you to practice it when you arrive to your clinical areas. Make sure that you do it slow, and that will be in order to prevent any contamination of your clean skin of your uniform. So make sure that you know how to do it and that you do it slow. On this slide, we want you to make sure that you are aware where to find the latest update about the PPE that we are going to be using within the OUH. And you can find them on the trust guidelines that they will be available on the OUH intranet. and you can find it on the infection prevention and control on the PPE section, and you can look as well for COVID-19 resources for clinicians. You can find the PPE resources as well available on the OxStar, and you will be able to access to that website without needing a VPN access. So I will always recommend you to make sure that you are aware of the latest update on the PPE, and you always can have a look to the videos available on there. So in that we can see a very quick visual guide about the levels of PPE that we are going to be using. So we have the level 1 PPE that we are going to be wearing eye protection, goggles or a visor. We can find as well the fluid-resistant surgical masks that are the masks that we are wearing, all of us, at the moment. We can find an apron. I would recommend you to make sure that you put the apron as higher as you can. And we'll be wearing gloves always, that we are going to have direct contact with the patient. On the level 2 PPE, we are going to have eye protection, and in this case it's going to be eye and face protection, and it's going to be a visor. We have to wear a FFP3 or an FFP2, or in some cases there are some people that will need to have some reusable mask, like first aid, 10 and some hoop respirator. That will depend on the fit test. We are going to wear in this case a long sleeve fluid repellent gown, and we have to put an apron over the gown, and we'll be wearing as well gloves. It is going to be very important, and I'm sorry for repeating it again, that we wash the hands before and after we are removing the PPE. Just make sure that you clean all the equipment following the trust guidelines. Make sure that you know which PPE you have to wear depending on the clinical areas where you are going to be helping around, and make sure that you take off the PPE steady and following every step. It is very important as well that you take breaks, and that don't forget about drink plenty of water and keep you well hydrated. So we have here the room signs. If the patient with confirmed or if the patient with confirmed or suspected COVID are inside rooms, that the signs that you will see, and it's a sign for dropped precautions. And we will see that we can be wearing level 1 PPE or level 2 PPE, and that will depend if the patient is undertaking any AGP. If the patient is in a side room without any AGP, then we can step inside with the level 1 PPE. But if the patient is having or is undertaking any AGP, then we need to wear level 2 PPE at all the time before going inside. This is a 3-color system that we are using at the moment for the allocation of patients around the trust from the admission areas. And the colors that we are using are green, amber or red, and that will be depending of the risk of the patient. So the green color is going to be for low-risk patients, and these are going to be patients without any COVID-19 symptoms, and patients that have the PCR swab for COVID-19 and the result is negative. So for these patients, we are going to be wearing level 1 PPE, that is going to be apron and gloves for direct contact with the patient. We are going to be wearing a fluid-resistant surgical mask, and the recommendation has been updated recently, and we need to wear eye protection always and every time that we are going to have direct contact with the patient as well. We have the next step on risk is going to be medium or amber color, and we have that this color is going to be for patients with no COVID-19 symptoms, but that we don't know yet if they are COVID positive or negative, because we are still waiting the swab result. For these patients, we are going to be using gloves and apron, fluid-resistant surgical mask, and we have to wear as well eye protection. It could be that inside of the amber color, we have patients without COVID symptoms, patients that we don't know yet the result from the PCR swab, but that they need to undertake some AGP. So in this case, we are going to be wearing a level 2 PPE that is going to be gloves, and single-use gown. We need to wear in this case a FFP3 or hoop respirator for AGPs, and once again we have to be wearing eye and face protection that it could be either single-use or reusable. Moving into the highest level of risk is the red color, and we can have two levels of patients as well. So we have patients that are suspected of having COVID-19, or it could be either patients that are confirmed that are COVID-19, but they are not undertaking any AGP. So in this case, for direct contact with the patient, we need to be wearing a level 1 PPE, that once again is apron, gloves, fluid-resistant surgical mask, and we'll be wearing as well eye protection. And the second group of patients on the high risk, we have patients with who are suspected or confirmed COVID-19, and that they need to undertake AGPs. So in this case, we are going to be wearing level 2 of PPE with gloves, long sleeve gown, FFP3 or hoop respirator, depending on the fit tested once again. And we are going to be wearing single-use or reusable visors. As we have been talking about level 1 PPE, the recommendations are going to be surgical mask. We have apron, and please remember to put it as higher as you can from of your neck. We are going to be wearing gloves. The footwear that we recommend is shoes that can be wipeable, and that is going to be very easy to clean with cleaner wipes. And eye protection, that it could be either a full face visor or goggles. In the next video, we are going to see how we need to remove or how we have to doffing the level 1 PPE, and then I will give you some key things that you should remember about it. So as you could see, the key things that we are going to remember and that we have to follow always is going to be when we are removing the apron, make sure that we remove it as far of us as we can. And when we are removing either the visor or the surgical mask, we should be keep our eyes closed in order to prevent any contamination or any drops to come to the inside the eyes, okay? We are moving now into the level 2 PPE, and we want you to remember that you should have a fit test before you are arriving to your clinical areas, and that if you are going to go into level 2 PPE, you must use only the mask that we have been fit tested for, okay? If the mask that you have been fit tested for is not available on your ward, please don't go into level 2 PPE. If you need to be using any reusable mask or a hood respirator, then you need to make sure that you have the extra training that will be available on the ELMS, and you will be given some advice as well for by the fit tester. And on the level 2 PPE, we are going to find an FFP3 mask or any first aid, first 10 or hoop respirator. We are going to be wearing a long sleeve fluid repellent gown, gloves. We are going to be wearing eye protection, and in this case is going to be a full face protection. And we are going to be wearing as well wipeable footwear. In this poster you can find some examples about the AGP, And some of the examples that I would like you to be aware are going to be induction of sputum, that is going to be done most of the time for chest physios. Any type of non-invasive ventilation is going to be an AGP as well. High flow nasal oxygen is considered AGP. Intubation, extubation or manual ventilation is considered AGP as well. The management of any tracheostomy or suction in a patient is a high risk, so it's considered AGP as well. And any bronchoscopy, for example, is an AGP as well. Just for you to be aware, nebulizers are not considered AGP. So if we are looking after a patient who need to have some nebulizers, we can be wearing a level 1 PPE. We have here a poster about the level 2 PPE doffing or removal, and in this case it's about if we are doffing in a side room. So we have two different parts. The first one, we are going to remove the apron and gown, and then we will remove afterward the gown, and when we remove the gown, then we will step out. We have to wash our hands following all the steps that we have seen previously on the video. And then we will step out of the side room to continue doffing the eye protection hat if we are wearing them, the mask, and we will clean the hands as well, always with either soap and water or hand sanitizer. And you can see the examples that from the video. You can see them on the level 2 PPE doffing video that I'm going to show you now. So as you could see on the video, after we are removing the gown and gloves, we are removing the apron with the hands. So it is going to be very important, the hand wash that we are going to have afterward before we are stepping out of the room. So make sure that you take your time and that you wash properly all the side of your hands, okay? Another thing to remember, very important, and that I said, I think, close the eyes when you are removing either the eye protection hat or mask, and you always can bend forward a little bit to prevent the uniform to get contaminated, okay? We have a very, very similar video about doffing. In this case, it's going to be in a court unit with doffing area, and it's going to be exactly the same that we do if we are doing in a side room, but we'll do everything on the same place, okay? I'm going to put you the video for you to watch everything aware and to try to remember the most important bit. Something very important that we need to remember when we are donning a level 2 PPE is please remember to put always first the mask, adjust the straps as you did when you were fit tested and following the advice from the fit tester, and then afterwards put over the hat. If you put the hat first and the straps afterwards, you are at risk of the strap to be moving around, and that will affect the fit of the mask on your face. So remember always first mask and second the hat, okay? If you are going to be working in a cold unit with confirmed patients who are undertaking any type of AGP, then you have to remember to change apron and gowns between patients, and also to change gloves and gowns between different techniques with the same patients. So if you are managing catheter or you are taking a catheter sample of urine, and then afterward you have to take a cannula or take some blood, to make sure that you change everything and that you put a new gloves and apron before going to take the blood. It is going to be very important that you only wear gloves and apron when you are having a direct contact with the patient and when you are delivering patient care. And please don't wear them either apron or gloves when you are on the nurse station, when you are doing some documentation on the note, or when you are going to go to the storeroom to take any material that you may need on the ward. And once again, please be aware if you are using a reusable mask or hoop respirator, make sure that you have the training available and the specific training for the device that you are using. So important and key points that you should remember always when you are doffing. Try to make it slow and steady. It is quite often that after being a couple of hours on level 2 PPE, people try to remove everything quite quick. So make sure that you do it slow, that you do it steady, and that you follow all the steps in order to prevent any contamination to yourself. Try to don't snap off the gloves and follow the pinch and pull technique that I showed you previously on the video. Practice it on your clinical areas and make sure that you know how to do it. As I said, try to remove the gown and apron, both of them, as far off your body as you can, and have a very good hand wash afterward. And very important as well to try and keep your chin up to prevent any contamination of your neck or the inside side of the visor. When we are doing the doffing and when we are removing the level 2 PPE, it is going to be very important that we are using the orange clinical bags and that the bins are empty enough for our PPE to be dropped. Please, if the bin is quite full, you can ask someone else someone for changing the bin in order to have the enough space for you to drop the PPE when you are removing it. Never, never, never push down the bin. And I have been talking about the level 1 and level 2. We suggest you to wear wipeable shoes. That is going to be the easiest one to clean with the cleaner wipes after you have been in contact with patient undertaking AGPs. And just to summarize everything that we have been talking about in this session, if you keep having a really good hand wash, hand wrap, making sure that you are covering all the side of your hands and all the parts from your hand, and you follow the recommendations about level 1 PPE and level 2 PPE when you are donning and doffing, that will keep you safe. So it's very important that we do things right. Once again, remember to do doffing very slow and steady, to don't forget an important step. Practice, very important, the gloves removal to make sure that you do the pinch and pull technique correctly. Drop the waste. As I said, never push down the bin. If the bag needs to be changed, someone else can give you support, but please make sure that when you are removing the level 2 PPE, you are dropping it to the bin. Good hand hygiene will kill the virus, so let's try our best and let's protect ourselves as much as we can. And as I said before, make sure that you are up to date with the latest update on the PPE that we are wearing on the OUH. You can find videos about PPE on the Oxstar intranet, as I said, and you can access them from home without VPN access. So that has been everything regarding PPE. If anyone is having any questions now. It was everything clear quite quick, but I think that the best about PPE is practice on the clinical areas. You will have posters on the dolphin areas, and it is likely someone will be able to guide you step by step. On the first wave, I was working on the respiratory ED, and we have plenty of medical students giving a hand, making sure that we were following every step. So please make sure that you protect yourself, okay? Perfect. Thank you.